afternoon. I'm Dr. Bermanis, public health physician, mostly in NCH, and welcome to today's presentation on iris pregnancy. Iris pregnancy is defined as where the woman and her fetus face a higher than normal chance of experiencing complications. But having a pregnancy that is considered iris doesn't mean you or the fetus will have the problem. Many people experience healthy prognosis and normal labor and delivery despite having special or health needs speeding up to the birth. What's the importance of high-risk pregnancy? It is to manage conditions like hypertension, diabetes mellitus, or other pre-existing health diseases. Regular follow-ups ensure that any complications are detected early and managed properly to reduce risk to both mother and babies. Overall, antenatal clinic follow-ups are vital for ensuring a healthy pregnancy and positive outcome for both mother and baby. It provides comprehensive approach to maternal and fetal health and encompassing preventive care, early detection, management of complications. What are the risk factors for high-risk pregnancy? Pre-existing conditions like diabetes mellitus, hypertension, anemia, lifestyle factors like smoking, drinking alcohol, use of drugs, organ transplant, thyroid diseases, twin pregnancy, or early pregnancy. What are the symptoms of high-risk pregnancy? The common symptoms include abdominal pain that is ongoing, chest pain, decreased or no fetal movement, extreme fatigue, fainting or lightheadedness, heart palpitations, nausea, vomiting, and fever of more than 100 degrees Fahrenheit. So the indicators for iris pregnancy, it is applicable for all across the board, but the ones for Bombay, we have the right, which there's a list of them, which includes decreased age, less than 80 years of age, increased age, more than 35 years of age, multiparity, meaning more than 5 children, multiple gestation, having twins or triplets, history of stillbirth, history of abortions, previous C-sections, history of laparoscopic baby, gestational diabetes mellitus, PIH like preeclampsia, eclampsia, IUGR, meaning ultrauterine coagulation, existing condition like diabetes mellitus, hypertension, asthma, rheumatoid valvular heart disease, strong family history of diabetes mellitus, anemia, moderate or severe, close facing meaning they deliver last year and they pregnant again regardless of the mode of delivery, whether they deliver naturally or through operation. History of placenta previa abruptio, that's the conditions of the placenta itself. History of group B streptococcus infection. Rh isoimmunization, meaning there's a negative and positive both in the blood for the baby, and history of preterm. So the high-risk pregnancy indicators which have been outlined or discussed include age, the existing condition, the pregnancy itself, the placenta, and the multiple gestation all lead up to mostly these conditions of hypertension, diabetes. So why is age considered the risk? Age may increase the risk of pregnancy complications either very young or over the age of 35. So for the teens, it can cause high blood pressure. It can induce preterm labor. And teens, they avoid prenatal care, which they are most likely to miss doctor's appointments. And they are less likely to know that they have STIs, which they don't have proper care. At 35, they can cause gestational diabetes, high blood pressure, miscarriage or stillbirth, ectopic pregnancy, a cesarean section, that's operation, genetic disorders, prolonged labor, and birth congenitals. The complications that pregnancy can do for the mother include hypertensive disorders such as gestational hypertension, preeclampsia or eclampsia, preterm delivery, cesarean delivery, excessive bleeding both during labor and delivery, low birth weight, birth defects, that is development of baby's organs like the brain or the heart, abortions, and stillbirths. So, high-risk pregnancy can be life-threatening for both the mother or the fetus. For the child, it increases risk for behavioral problems, respiratory conditions, gastrointestinal disorders, growth and development delays, mental health conditions, obesity and diabetes mellitus, and it can cause vision, hearing, or dental problems. Behaviors really can lead to high risk pregnancy, and our actions affect our babies, the babies, which can cause low birth weight, as already been mentioned, preterm labor, and premature birth. Okay, and it can even cause pregnancy loss. So, how is high risk pregnancy diagnosed and monitored? Getting early and thorough prenatal care is very critical, and it is the best way to detect and manage a high risk pregnancy, and special monitoring throughout the course of pregnancy. So for laboratory studies, these are the routine labs that are done across the board for all, both high risk and low. And it includes all blood count, blood type or the Rh factor, urinalysis, all the STI profiles, which include HIV, hepatitis B, syphilis, cholera, chlamydia, group B streptococcus, and gestational diabetes screening. For biophysical profile, this is a fetal monitoring for the fetus, which includes which combines both ultrasound imaging and a non-stress test. So this procedure is a painless one, and it is done to assess the well-being of a fetus in the uterus. It is performed after 32 weeks gestation, and it is indicated for iris, pregnancy, and abnormal tests. Okay. The biophysical profile, it includes 5 components. The non-stress test, that is the use of this integral cardiotopography monitoring, which is on the right. You can see the slide on the right. This is why Bombay is using it's a new non-stress test now, because at the labor and at the hospital there's one, but it's only situated in the labor room. Whereas this one, we were fortunate that it's donated by the government, the people of Japan. Now that is installed, all the dispensaries can use. And it is used to monitor not only during labor, but it can be used during the time that they come for checkup. So the 5 components of the biophysical profile includes the non-stress test. And this thing is to test the movement and the contraction, the movement of the baby and the contraction that the mother is having. That is during labor. To assess the amniotic fluid, the amount of fluid that the baby is in. And the third one is the breathing movements, fetal movements like flexing and flexion of the extremities, and the fetal tone. Again, this is the strip of that is done when we're using the non-stress test. Like I explained it, it monitors the contractions of the uterus and the movement of the baby. Okay. So overall, generally speaking, the ultrasound, we monitor the fetus breathing movements, the body movements, the muscle tone, and the amount of fluid. So the modified one, basically we're measuring the heart rate, the amniotic fluid, and the location of the placenta. So management. How do we manage high risk pregnancy? Management will really depend on the specific risks. It needs close monitoring by the obstetrician as well as consultations with other specialists, more ultrasound and closer fetal evaluation, monitoring of the blood pressure, and encouraging healthy diet. Okay. We also have to really explain the need of reducing stress, proper bed rest. Prevention. How can we prevent early high-risk pregnancy? So some of these things are lifestyle interventions like avoid beverages containing alcohol, quit smoking, to identify potential risk for getting pregnant, and maintaining a body weight that's healthy before getting pregnant. Okay, getting regular checkup, daily intake of your care vitamins, boric acid, and iron, staying away from stress, and exercising. So it is we have to manage any pre-existing conditions. Make sure that the long-term medications are safe to take during pregnancy and practice safe sex and reduce risk for STI, sexual transmitted infections. Uh, being a pregnant woman being diagnosed as a high risk is really a worrisome for the mother. It can cause some emotional problems too. But first, we have to really emphasize that they need to relax. They need to build a support group which they can lean on their families or their friends, focusing on healthy habits like getting enough sleep, exercise, and eating nutritious foods, prioritizing self-care like taking care of themselves, both body and mind, and attending to all appointments. So overall, the goal is to increase their chances that the high-risk pregnancy has a successful outcome. So looking back into our settings, I would like to highlight what LAC or high risk were like in the past. So both high risk and low risk clinics were high risk clinic was separated, which is being held at public health on Thursdays. And the low risk pregnancies are held at the dispensaries and the community health center. For referrals for high risk, they all refer to public health. So as on this slide shows when high risk was separated, so the number of initial visit during the initial year of that we began was 110 with follow-ups of 247. So from this year, since January to October of 28th of this month, our follow-ups are 668 with the initial visit of 207. So our indicators for this year, there are 24 indicators, which close spacing is shown to be the highest, followed by by anemia with 57 cases of moderate, severe 3, mild anemia 1s, and increased age like more than 35 up, we have 50 of them. So these are all the indicators that we have. We have about 24. So you can see that multiparity, meaning more than 5 children, there were 45 cases. Previous sections 27. And interestingly, with our age, decreased age, at 17 we have 12, followed by the 16 followed by 6 at seniors of age and 6 at 15. So the other indicators are mostly like neonatal death, quadruple gestation, history of macrosomic baby, not much of a diabetes for only one diabetes, hepatitis B, and rheumatic valvular heart disease. So, like placenta previa, malpresentation that's breach, hydrocephalus is one, preterm, and HELP syndrome. Very rare cases, but we do have is the HELP syndrome. So the take-home messages are the increased awareness in importance of attending antenatal care as early as 3 months, importance of daily intake of prenatal vitamins with folic acid and iron supplements, advocate for the number of antenatal contacts at least 8, lifestyle interventions like with smoking, use of alcohol, suckle, peanut nut, and use of illegal drugs, and encourage the use of healthy diet, particularly when we have a number of anemic pregnant women. So we advocate for the use of local food like the Congo and the chai. And thank you for listening.